See, I want to teach you digoxin and digitalis, and that's why this chapter is here. Nothing else. This chapter is meant only to teach you digoxin. Only to teach you digoxin. Nothing else. This is a wonderful drug, and a drug is made by God for failing heart. Because all of the properties of digoxin are best seen in the failing heart patient. Many of the properties cannot be seen in a normal individual. My point is very important. I am repeating my words. Many of the properties of digoxin are seen only in the patient of failing heart, that is CCF, congestive cardiac failure. Those are not even observed in a normal individual. I would like to give you a very simple example. Peripheral vasodilation is seen in the patients who are having CCF. But if you are using digoxin in a normal individual, it produces vasoconstriction. CCF patient shows diuresis with digoxin, not seen in the normal individual. This is a drug, digoxin is a drug which is used to increase the force of contraction of the heart without corresponding increase in myocardial demand of the heart. The sodium comes in and depolarization starts, okay? And repolarization takes place when potassium goes out, and is completed when potassium is out and the cell is repolarized. Am I right? No one asked me, sir, या सोडियमचं होतं काय नंतर? परत पुढचं काम करावं लागेल की नाही? अरे पुढचं काम केलं पाहिजे की नाही? येस. तर इथे एक एक्सचेंजर असतो, त्याला म्हणतात सोडियम पोटॅशियम एटिपेज पंप. हा sodium potassium ATPase pump is responsible for throwing out of 3 sodium. Throwing out of 3 sodium and taking in of 2 potassium with the help of ATP. It is ATP dependent pump. It's an active pump. जे काही जमा केलं आहे आपण आतमध्ये सोडियम जमा केला, अरे डिपोलरायझेशन झालं, सोडियम आत घेतला ना आपण, पोटॅशियम बाहेर टाकला, हो तुझं काम झालं माझ्या दादा, पण आमच्या सोडियमचं काय? आता आत येऊन बसलेला, याला बाहेर टाकायला पाहिजे की नाही? गेटिंग इट? आणि बाहेर पोटॅशियम टाकून ठेवला आहे, त्याला आत आणला पाहिजे, त्याच्याशिवाय पुढचं फंक्शनिंग होणार नाही सेलचं पुढचं फंक्शनिंग व्हायला पाहिजे की नाही? तर इथे एक्सचेंजर बसवलेला असतो, तो असा एक्सचेंजर पकडा तुम्ही. मुद्दाम असे त्याला शेंड्या दाखवले मी, की जेणेकरून बाहेर टाकतो कोण? 3 सोडियमला, आणि आत कोणाला घेतो? 2 पोटॅशियमला. समजलं? आता हा ATP डिपेंडंट पंप आहे. ATP डिपेंडंट. डिगॉक्सिन बाइंड्स टू इट. Digoxin binds to it. When digoxin binds to it, there is a problem that sodium is accumulating in the cell. Sodium is accumulating in the cell. Now cell has to find out some other way to put this sodium out. So there is another pump that is also located on the cell surface. This is known as कॅल्शियम सोडियम, वाक्य महत्वाचं आहे, एक्सचेंजर पंप. Sodium calcium exchanger. Now we are having excess of the sodium. This sodium will go out, and instead of that, in exchange to that, we are getting calcium in. Now the calcium percentage of the cell is increasing. You blocked, digoxin has blocked, sodium potassium ATPase pump. That's why accumulated sodium is a problem for the cell. Cell operates, sodium calcium exchanger. Sodium is being thrown out and calcium is being coming in. This is how calcium percentage of the cell has increased. Calcium percentage of the cell has increased. When calcium percentage of the cell is increased, it is very necessary to get coupling actin-myosin. Actin-myosin coupling will start and cell will put full pressure. That is, force of contraction of the heart will increase. And this is how digoxin is working. This is the molecular mechanism of working of digoxin. How exactly it works. It increases the intracellular calcium. It increases the availability of intracellular calcium. When the intracellular calcium increases, the actin-myosin coupling will be more. Force of contraction of the heart will increase. And that is the main property of digoxin. It reduces the heart rate but increases the force of contraction. Now he is thinking, sir, how it is going to reduce the heart rate? It is having vagomimetic action. Vagus, all of you know vagus? Vagus is a mixed nerve, 10th cranial. Vagus is a mixed nerve. Its parasympathetic supply is to the heart. And parasympathetic supply is related to? Very cholinergic, means reduction in heart rate. Digoxin potentiate that effect. त्याला म्हणतात vagomimetic. It mimics the vagus. It works like vagus stimulation. It stimulates the vagus. When you stimulate the vagus, heart rate reduces. Are you getting my point? The two important properties of digoxin. Which are that two? One, it blocks the sodium-potassium ATPase pump, thereby increases the entry of calcium by sodium-calcium exchanger and increases the force of contraction of the heart. This is one point. Second point is, it is having vagomimetic action. In one way, it stimulates the vagus. When vagus is stimulated, vagus is a parasympathetic. Vagus is a mix actually, but the supply to the heart is parasympathetic. Supply to the heart is parasympathetic. When you stimulate a parasympathetic nervous system, the heart rate reduces. Because parasympathetic nervous system is principally inhibitory in its function. When you stimulate the system, function of the organ concerned reduces. So these are the two properties. And that's why, what is the end result? When you give digoxin, heart rate reduces. And force of contraction increases. Now, the next sentence is very important. Without corresponding increase in oxygen demand. Without corresponding increase in oxygen demand. Why? Very simple. Initially, you were giving 72 beats. Now you are giving 60 beats. So we save the energy. And that energy is utilized for making the stroke more stronger. Are you getting my point? Are you getting my point? मराठीतनं सांगतो. 72-75 ठोके आपण पूर्वी देत होतो. आता आपण किती ठोके देतोय? 60. पण आपण 60 ताकदीचे ठोके देतोय. आणि म्हणून आपल्याला ऑक्सिजन वाढवावा लागत नाही. तो जो 12 ठोक्यांमधला ऑक्सिजन आपला वाचला, तोच स्ट्रोक व्हॉल्यूम वाढवण्याकरता आपण वाढवतो. स्ट्रोक फोर्स वाढवण्याकरता वापरतो. आर यू गेटिंग माय पॉइंट? येस. अँड दॅट इज द युनिक प्रॉपर्टी ऑफ डिगॉक्सिन. Digoxin increases the force of contraction of the heart without corresponding increase in oxygen demand. And that is why this dangerous drug is there. Getting my point? Yes. Getting my point? Yes. Getting it? Yes. आता याचा साईड इफेक्ट काय होईल सगळं सांगतो मी. मला काही नाही रे, मी खूप वेळ छान बोलू शकेल. याचा प्रॉब्लेम काय होईल सांग बरं. सोडियमचं तू केलं काम बाबा, पोटॅशियमचं काय दादा? पोटॅशियम जर राहिला सेलमध्ये, सेलच्या बाहेर, तर मग हायपर कॅलेमिया इज अ प्रॉब्लेम विथ डिगॉक्सिन. हायपर कॅलेमिया इज अ प्रॉब्लेम विथ डिगॉक्सिन. अँड दॅट्स वाय इट इंड्युसेस arrhythmia also. That why it induces arrhythmia also. The arrhythmogenic potential of digoxin is due to the disturbance of exchange of potassium. Blood potassium level rises. तो आपण आत घेतला नाही ना त्याला. घेतला का त्याला तू आत नाही, तर ते डिस्टर्ब होऊन गेलं आहे. सोडियमची सोय लावली तू, पोटॅशियमची सोय लावायची राहून गेली. गेटिंग इट? येस. या. A group of compound obtained from the simple sugar by replacing the OH group. Sugar, if get replaced, OH in the sugar, if get replaced by anything, that is known as glycoside. Simple. OH in the sugar, if get replaced by anything, that is known as glycoside. So these are the glycosides from foxglove. Foxglove is the plant. Hrudpatri is known in Sanskrit. Introduction. These are some compounds having cardiotonic. The word cardiotonic means they do not require oxygen, they do not increase the oxygen demand, but they increase the force of contraction. That's why the word is cardiotonic. They increase the myocardial force of contraction as well as the cardiac output in a hypodynamic heart of CCF patient without corresponding increase in myocardial oxygen demand. Are you with me? All digitalized compounds have similar pharmacological profile. Digitalized or digoxin, the same way, is explained as a prototype. Rather, this is the only drug we practically use. Digoxin. Heart. Already I talked to you about. It increases the force of contraction of the heart without corresponding increase in oxygen demand of the heart. Heart rate reduces, force of contraction increases. This is the principal effect of digoxin, for which digoxin is very famous. And that's why the word cardiotonic is there. Cardiotonic word is there. In dose-dependent manner, contraction of the heart increases the period of diastole, decreases the period of systole. It is especially remarkable. Everything related to the digoxin is remarkable in the failing heart. I already used the word God has created digoxin for the patients of CCF. That you will recognize, that you will find, that you will also say. God has created digoxin for the patients of CCF. Because every property of digoxin is remarkable in failing heart. The heart rate is decreased by digitalis by vagomimetic action. Already I told you. It has suppressive effect on the impulses from SA node and maybe completely block the impulse generation at the toxic level. Even therapeutic doses slow the conduction of the impulse. Underline the words. It slows the conduction of the impulse. What is the effect, my dear student? It should not be used with digoxin. Digoxin should not be used with beta blockers. It also blocks AV conduction. It should not be with cardiodepressant calcium channel blockers like verapamil and diltiazem, because it also blocks AV conduction. And that's why digoxin should not be used with beta blockers. Digoxin should not be used with cardiodepressant calcium channel blockers. CCBs means only which CCB? Cardiodepressant. Cardiodepressant or cardioselective we call them. Cardiodepressant and cardioselective is the same word. In the patient of heart block, can you use this? No, Baba. Already there is problem of conduction. This also reduces the conduction. AV conduction is blocked. Atrioventricular conduction. And that's why it should not be used in the patients of HB. Heart block patient on beta blocker, patient on CCBs. CCBs, but which CCB? Cardiodepressant. Effect on the blood vessel. Already I talked to you about this effect. In a normal person, vasoconstriction is seen, but only in the patient of CCF. Yes, vasodilation is seen. It has mild vasoconstrictor action. Peripheral resistance increase in the normal individual. However, in the patient of CCF, the overall improvement in the circulation, that is reflex sympathetic overactivity, is withdrawn, and there is net decrease in the TPR is seen only in the patient of CCF. In normal individual, vasoconstriction. Only in the patient of CCF, vasodilation. This is important property. Digitalis has no prominent effect of BP and hence is not contraindicated in the patient of BP. She is thinking that, Dr. Joshi, what you are telling, It increases the force of contraction, sir. It should increase the blood pressure, sir. Why are you saying that blood pressure is not affected? Yes, my dear student. Force of contraction is increased and you are dilating the blood vessels. You are dilating blood vessels. When you dilate the blood vessel, you increase the force of contraction. BP will be unaffected. The system मध्ये blood pressure तेव्हा generate होईल जेव्हा कोणीतरी अपोज करतोय. You are increasing the force of contraction by dilating the peripheral blood vessels. It is BP is significantly unaffected. And that's why rise in the blood pressure, if it patient blood pressure is high, you can use digitalis, you can use digoxin. There is no problem. BP is not a contraindication. Hypertension is not a contraindication for the use of digoxin. Getting my point? Already I talked to you and told you that yes, it has shown the diuretic effect is promptly seen in the patients of CCF. No diuresis occur in the normal individual or the patient of edema due to some other causes. There is no problem. Are you getting my point? Yes. Everyone is with me? Only in the patient of CCF it shows diuresis, not in the normal individual. Only in the patient of CCF, diuresis. Diuresis is not seen in any other edema. No other edema, it shows diuresis. Only in the patient of CCF, it shows diuresis. And that's why I told you the word. God has created digitalis or digoxin for the patient of CCF. You will also say this. CTZ stimulation is strong. On the day 1 of giving digoxin, most of the patient develop nausea and vomiting. When loading was there, right now today we don't go with the loading. Practically AHA do not recommend the loading dose of digoxin today. It has effect on CTZ. CTZ chemoreceptor digoxin. On the day 1, actually loading is with the 3 tablets. Maintenance is with 1 tablet. That is what I told you. But today, currently, no one recommend loading of digoxin. You have to wait for a week to get the effect of digoxin, and that we accept. Because by giving 3 tablets on the day 1, there are many issues, including arrhythmia. Arrhythmia is a part of digoxin therapy. Nausea vomiting will be high. And that's why digoxin is not given today by loading. We try to avoid it by loading. AHA do not recommend digoxin by loading doses because of the toxic effect of the digoxin. Earlier days we were giving it by loading. It has effect on CTZ, produce nausea and vomiting. Still higher doses produce the central effect like mental confusion, restlessness and even disorientation. Getting my point? Yes. I have seen all these things. Getting it? Yes. Pharmacokinetic properties. It has a plasma half-life of 1.6 days. We have taken the calculation in Plateau principle. The calculation was a practical calculation of digoxin. I told you 233 and 333 and 233. I told you. There we decided that the 3 tablets should be given on the day 1. Am I right? Yes. The large volume of distribution, it's very excellently distributed in the body, especially in the muscles it is distributed. Excellent distribution. It's a long-acting drug in that way. In case of digoxin, all are concentrated in the heart, skeletal muscle and the kidney. Skeletal muscle is the major site of accumulation of digoxin in your body. Digitoxin is primarily metabolized in the liver to digoxin. We don't prefer to use this digitoxin. We use always digoxin. Digoxin by the famous trade name of lanoxin. Digoxin is available as digoxin as well as lanoxin. And digoxin is excreted unchanged in the urine. The drug which we give practically remains unchanged in the body. The action is prolonged in the renal insufficiency. Common sense, the drug is excreted by kidney unchanged. When kidney is not working well, the drug is going to accumulate in the body. Doses has to be reduced because of low safety margin of the drug. Digoxin is highly low safety margin drug. Yes, if you are using little higher doses, you will get nausea, vomiting, disorientation that I have written. If you are using little low doses, digoxin will not show you therapeutic effect. And that's why it is the drug, it is one of a very important drug having least safety margin, very short safety margin. All drugs have cumulative properties, steady state plasma concentrations are seen in 6 to 7 days, and that is what I am trying to tell you. Right now today, we do not prefer to use the drug. We do not prefer to use the drug by loading. We always prefer to use digoxin today by only single dose. Single dose. And you have to wait for 8 days to get the complete effect of digoxin, because SSPC will develop slowly. Daily I am giving only one tablet. It will take some time to develop steady state plasma concentration. But we accept that. Why we accept that? Because we know that loading will cause serious side effects. It's a low safety margin drug. Arrhythmia is bound to happen on the day 1. Nausea vomiting is bound to happen on the day 1. To avoid all these side effects of digoxin, we prefer to use digoxin only by single dose. On the day 1, we will give 1 tablet, day 2 1 tablet, and this is up to 7 days. The patient will develop slowly increasing SSPC. Steady state plasma concentration will be achieved by single daily dose, not by giving loading dose. AHA, American Heart Association do not recommend the dose like that. Uses of digoxin. Uses of digoxin. What is that? Congestive cardiac failure. CCF is the only indication. In CCF, the heart is in the hypodynamic status. Clinically, the patient presents with generalized edema. Digoxin and its derivatives are of prime importance in such situation. Agree with me? They are primarily cardiotonic action. They increase the force of contraction without corresponding increase in the oxygen demand of the heart. With the help of these drugs, the heart pumps the blood with force. Agree with me? Second important thing is that these drugs, they have diuretic action for the patients of CCF only. Only in the patient of CCF, it produces diuresis. And thus clinical improvement is seen. It is helpful in the reduce the edema, and thus clinical improvement is seen in the patients of CCF. Lastly, they tend to decrease the total peripheral resistance. They reduce TPR, thereby reducing the afterload of the heart and then hence reducing the cardiac work. Getting my point? Yes. 3 points are there. They are peripheral vasodilators. First, they increase the force of contraction. Second, they are diuretics. And third, they are peripheral vasodilators. All contribute to their great effect in CCF. Now I am going to tell you a very important thing. It is seen, it is well established that the survival of the patient doesn't improve. औषधं देऊन आणि औषधं न देऊन त्याचे टोटल आयुष्य नाही फारसं बदलत. आणि म्हणून digoxin is to be used to keep the patient symptom free, to keep the patient moving, but it is not useful to increase the lifespan of the patient. And that is the reason today we are preferring telmisartan, we are preferring calcium channel blocker, dihydropyridines, as a patient in the treatment of the patient of CCF. We use digoxin only when the patient is really decompensated. When patient is having the symptoms, then only then we prefer this digoxin. Now, digoxin should not be called as drug of choice for CCF, because it is no longer a drug of choice. It is a supportive drug, especially in decompensated heart failure patients. Now, diuretics, calcium channel blockers, and the drugs like telmisartan, like ARBs and ACE inhibitor, are the main drugs to control CCF. Digoxin 0.5 milligram per 2 ml tablet digoxin 0.25 milligram. ते बाकीचं पेडियाट्रिक एलिक्झर वगैरे तुम्ही बघा. Dose of 3 tablets stat followed by 1 tablet OD as a maintenance dose, but this is not recommended today. Today we recommend only 1 tablet, and to get the best benefit you have to wait for a week. Getting my point? Slowly daily the improvement will be seen in the patient, and that we accept in case of digoxin. Digitoxin we don't prefer. Thank you, dear students.